Hello, we are Group 24. The first article we would like to talk about is Exploring the Potential for Technology to Improve Cystic Fibrosis Care Prevention, Patient and Professional Perspectives. Cystic fibrosis is a life-shortening genetic condition and is the most common fatal genetic condition. It requires a strict daily regimen and attendance at clinics for routine monitoring by multidisciplinary teams. The chronic care cycle describes the interplay between home and clinic based care that many patients with cystic fibrosis require in order to function. Within the chronic care cycle, patient health information is integrated, compared, and utilized across home and clinic based care systems. Home based self monitoring used in chronic care cycles need to function within a collaborative activity which seeks to include both the patient in their home setting and the clinician in their clinical setting. We must also remember the importance of context in regards to chronic conditions and how each one has its own set of concerns and its own management burden. These particulars mold the care distribution between patient and clinician.
So the method that the research team has used was called grounded theory. It's an inductive reasoning research method that's widely used in qualitative healthcare research. It's, it is an ongoing and iterative process of data collection and analysis, and it derives theoretical concepts along the way. The site that they chose was at a CF center in a UK hospital. Uh, in 3 days, they observed over 10 consultations and then conducted 18 interviews with a median of 59 minutes in an open-ended question form. Uh, then, in the analysis process, they use concurrent data collection and analysis with constant comparative process. So concepts were built in the initial 3 rounds of interviews and then get modified in the subsequent rounds based on the previous result.
Hi, my name is Sabrina, and I'll be talking about the results of the study. So first, they found that there's significant time and effort required to manage CF, and with so many factors such as taking medication, exercise, and more, it can be really difficult to follow all the recommendations, especially when it interferes with a person's family, work, and social lives. In addition, there's a need to bridge the gap between patients and clinicians, especially when patients are collecting daily data that they don't know how to interpret. In addition, patients don't want to be defined by their illness. For example, they prefer concealed wearable devices and do not tell their coworkers, friends, or family that they have CF. This can lead to less adherence to their treatment plan, which would have a long-term negative effect on their health. I can partially relate to this because my food allergies impact the restaurants that I can go to when I hang out with my friends, and sometimes it's hard for me to tell them because I don't want to make things difficult. In addition, based on clinician and patient opinions, there are 3 possible ways to restructure the care system, which are data augmentation, remote triage, and remote clinics. Some concerns are increased burden on the patient as well as data overload. Finally, clinics would still be necessary because remote clinics are not suitable for all types of visits or patients.
So, in the Health IT News article, the increasing trend of telehealth care and patient experience is discussed. Telehealth is the distribution of health-related services and information via electronic information and telecommunication technologies. It allows long-distance patient and physician contact, care advice, reminders, education, intervention, monitoring, and remote admissions. The main benefits include expanding the access to care, making care more convenient and addressing talent gaps and shortages, improving care coordination, better monitoring and treat at-risk populations, and expanding population health programs. 9 out of 10 healthcare organizations are adopting the use of telehealth care, making it much more prevalent. There are a vast variety of health services that are provided through telehealth. Although it is common, most patients and professionals still prefer face-to-face consultations. So personally, I believe telehealth is a type of healthcare that will continue to grow and better the healthcare system as the years go by. It allows for more accessibility and quick feedback and service from a professional. So telehealth will improve the efficiency of the patient's experience. Although telehealth allows for beneficial growth in the health field, I believe it will never replace the dependence and reliability of face-to-face consults. It will simply be an assistance tool that is able to consult patients that do not need a face-to-face consult.
So this week in class, we had 2 guest speakers. We had Jose De Vega on Monday and John Autumn Brown on Wednesday. And both lectures were pretty business-oriented, which I think is fitting, having just done the hackathon. And so Jose De Vega talks about the importance of prototyping, especially before applying for a grant, so that once funding is received, then you have something to show for it and you're able to develop your product. And he also talked about like the importance of mocking your product up when you don't have resources, and that you shouldn't just sit around and do nothing just because you don't have the resources. And I think he actually set that up perfectly for John Autumn Brown on Wednesday, because Mr. Autumn Brown was able to talk about applied innovation and the Cove and the different resources that they offer, such as mentorship in the early stages of product development, as well as helping with grant proposals and offering like funding, like small amounts of funding for people who are just starting to prototype, or even just like laser printing for marketing. And like I said, I think this is perfect timing, having just done the hackathon, because we've already gone through those stages where we have an idea, and now the next step would be to implement it.